A 28-year-old woman pregnant with her first child comes to the obstetric triage unit at 34 weeks gestation, complaining of a persistent throbbing headache for the past 2 days. She says the headache is mainly frontal, does not improve with rest, and feels different from any headache she has had before. She also reports new swelling in her hands and feet and mild upper abdominal discomfort. On arrival, her blood pressure is 168 over 112, significantly elevated. She appears uncomfortable and slightly anxious. Her face looks more puffy than usual, and her wedding ring feels tight. She denies contractions, vaginal bleeding, or fluid leakage, but mentions seeing flashes of light in her vision earlier this morning. Physical examination reveals brisk, deep tendon reflexes and mild right upper quadrant tenderness. The fetus has normal heart tones. A urine dipstick test shows 3+ protein, and blood tests reveal elevated liver enzymes and a slightly low platelet count. Her serum creatinine is mildly elevated as well. These findings strongly suggest pre-eclampsia, a pregnancy-specific condition characterized by new-onset hypertension and organ dysfunction. Pre-eclampsia occurs due to abnormal placental development that leads to widespread endothelial injury, vasoconstriction, and leaky blood vessels. This results in high blood pressure, proteinuria, headaches, vision changes, swelling, and potential damage to the liver, kidneys, and brain. If untreated, it can progress to eclampsia, which involves seizures, or to HELLP syndrome, a life-threatening complication. Because the patient is 34 weeks pregnant with severe features, including very high blood pressure, proteinuria, liver involvement, and neurologic symptoms, she requires immediate management. She has started on magnesium sulfate to prevent seizures and antihypertensive therapy to control her blood pressure. Continuous maternal and fetal monitoring is initiated. In cases of severe preeclampsia at this gestational age, delivery is the definitive treatment. After stabilization, the obstetric team prepares for an expedited delivery, often via induction of labor if conditions allow, or cesarean section if needed for maternal or fetal safety. Key takeaway: severe hypertension, proteinuria, headaches, visual disturbances, and organ dysfunction in pregnancy strongly indicate preeclampsia. Early recognition, magnesium sulfate, blood pressure control, and timely delivery are essential to prevent life-threatening complications for both mother and baby.